So today I'm going to be going over the differences between gram-negative and gram-positive bacteria and how it applies in a clinical setting as far as testing your sample goes and performing that procedure as well. So the main difference is that gram-negative bacteria, between gram-negative and gram-positive bacteria, is that gram-positive bacteria has a thick peptidoglycan layer and no outer lipid membrane, while the opposite is true for gram-negative bacteria. So these bacteria will stain differently on a gram staining procedure. So your gram-negative bacteria will stain pink, while your gram-positive bacteria will stain purple. So typically in this procedure, you're going to first start with flooding your stain with crystal violet solution, which is your primary solution that adheres to the cell membranes. So you'll let this solution sit for about a minute, and then you'll rinse with water. Then you'll move on to step number 2 once it's completely dry, which is to apply your iodine solution, which acts as a mordant to help to stabilize the dye on your microscope slide sample. So you're going to do the same thing as step 1. You're going to apply the iodine, let it sit for about a minute, and then rinse with water. Then you're going to move into decolorizing your stain with ethanol, and then you're going to rinse that one with water as well. So ethanol mainly works to penetrate the cell wall and to remove the crystal violet iodine solution that you had applied in step 1 and step 2. So your last step is to apply your counter stain with safranin, and you're going to repeat the process in this step like you did with 1 and 2. You apply your solution, let it sit for about a minute, and then rinse with water. So the safranin directly stains the bacteria that has been decolorized by the ethanol. So overall, gram staining has been used clinically to differentiate between the chemical and physical properties of bacteria cell walls. And these gram staining procedures can be used as preliminary results to show the type of bacteria as far as showing the shape, and then whether or not they are gram-negative or gram-positive bacteria. So once the healthcare provider knows whether or not the stain is gram-negative or gram-positive with the type of bacteria that's causing their patient's infections, they're able to more effectively treat their patient since they know what type of bacteria was causing the infection.